Today I'm happy to talk about one of the newest aspects of our practice in that we are going to get physical. Now, what do I mean by that? Well, we partnered with a national physical therapy company called Fyzical. It's not exactly spelled the way you'd expect, and it's spelled differently because it is something different. And what we decided to do was that by bringing the physical therapy treatment to the balance portion of our practice, we'll be better able to not just help our patients, but monitor them and ensure that they have better outcomes. Now, the balance dilemma that's facing our country right now is often overlooked. Right now, they estimate that about 63 million people in our country are at risk of a fall. Primarily, these are thought to be elderly patients, and there are 10,000 people every day who turn the age of 65 or older. And of these people, 1 in 3 are expected to have a risk for a fall. Now, of those people who fall, 1 in 5 would not survive the fall, and there is a high risk for other injuries such as a broken bone or even a head injury. And so this is something that we decided to take on and see if we could help patients maybe identify those at risk and offer them therapy to stop the fall before it happens. Up until now, therapy has been designed towards treating things after it happens. How many times do we see someone stumble or trip and tell them to be careful after they've already stumbled or tripped? And when these patients fall, a lot of times they're treating the injury. If they hurt their elbow or if they hurt their hip, the therapy currently is looking at rehabilitating their elbow or their hip, but not the actual balance deficit which caused them to fall in the first place. So we decided to take it one step further and bring in the latest diagnostic equipment, the technology if you will, and see who is at risk, identify their problem, and then take it to vestibular or balance therapy. Now, we felt that as an ENT, since we see the majority of dizzy patients in our practice, that it would make the most sense for us to identify these patients at risk and to treat them. In the past, we've primarily focused on patients who have had inner ear disorders and focused primarily just on taking care of what was ENT relevant. A lot of times, though, the patients coming in when they're dizzy, they have multiple factors contributing to their problems. Sometimes it's an inner ear problem, sometimes it's their eyes, sometimes it's their age, their spine, or perhaps a combination of multiple different factors. And in the past, a lot of doctors and specialists would focus on their slice of the puzzle and try to get that better, but the other pieces would go untreated and ultimately would not be the best outcome. So in partnering with Fyzical, we now have clinical protocols and treatment strategies that have been worked and streamlined to offer people the best chance at not just fall prevention, but at regaining their independence and returning to their everyday lifestyle, not just living their life, but really loving their life. And that was one of the goals of the physical therapy that we hope to bring to our office here in Winter Park. Now, if you or someone that you know, a family member or anyone else who might have a balance challenge or issue, please, I encourage you to give our office a call and we can get them in and have one of our balance experts evaluate them appropriately.